do you foresee other mechanisms in order to address eating disorder in the state of New York, which is a growing problem among our teenagers in our school system?
Absolutely. That's part of the programs that we're putting together a competitive program with an option to look at obesity and other public health problems at a higher level than we've been able to with specific smaller programs. If we can address this as part of a comprehensive approach to obesity, that's our goal. Certainly obesity is our number 1 or 2 priority, and eating disorders as a part of it in adolescents and youths is fundamental. There will be a competitive RFA coming out in the next month where we can address these issues.
This to the previous health commissioner, and it just seems to me that when you were talking about the EPIC program, you said you know, people have to be responsible for their health or their medication. They have to be responsible, and it just seems to me at some point in the state of New York, we really ought to talk more about this personal responsibility. And it seems to me that we have one way to get people pretty quickly to eat healthy foods. And since we provide, through the federal government, food stamps and other assistance that are paid by the taxpayer, I was told last year that we would have to get a waiver from the federal government. Would you be willing to apply for a waiver for the good health of the people in our community so that taxpayers know their money is being used for healthy foods and that we don't have compound the problem with people that are unhealthy and being more in need of health care?
Yeah, I believe that we have been in discussions with about what sort of a waiver would be required for food stamps to fund only certain types of food or limit purchase of high-calorie, low-nutrient food. That has been something that we've been working on, and I believe our public health group is actively pursuing that.
Has any other state tried it, applied for a waiver? Do we know? It just seems to me that I don't know what the complications are of studying it. It just seems to me it'd be pretty simple request.
No one, to my knowledge, no one else has actually. No other.
But I'll just make that pitch again. It just seemed, and you know, this may be controversial as well, but it seems that if people are supposed to be responsible for their own health, it would seem that rather than having insurance coverages that are the same cost to everyone, whether they take care of themselves or don't take care of themselves, doesn't make a lot of sense to me when those that don't care. Of course, certain people have conditions that you can't have any control over. I'm not suggesting that. But if the obesity rate and people that eat sugared foods and so forth and so on are more likely to have diabetes and all of these other conditions, more likely to go into the healthcare system and cost the state a fortune, it seems to me that maybe there ought to be some kind of, there was a talk about a tax on sugared drinks. Well, maybe if someone's not following what their doctor's supposed to do or good medical practices, maybe there ought to be some kind of penalty for that. Just something for you to consider. I'm not asking for an answer. It just seems at some point, if the healthcare costs are rising because of obesity and there's no reason to take care of yourself, it's going to continue. Thirdly, the last point concerning this topic, I've had a bill in to create a governor's council on physical fitness. There used to be one in the federal government. I think Arnold Schwarzenegger, and then he went to bigger and better things, was the poster child. Would you talk to the governor? Because about 3 or 4 other governors didn't think it made any sense. But it seems if we had some high-profile people that started talking about healthy habits, it might help us a little bit as far as healthcare costs.